Hey, Dr. Chris here from Square One Health, and today we're doing our live at 5. Today, a special treat. I'm going to deep dive into a couple papers that talk about how specific sports or activities could impact scoliosis in adolescents. And I'm going to talk about swimming, gymnastics, and dance. And right off the bat, because I get asked about these are a lot of times this first one, a lot of times swimming is actually something that's prescribed as a treatment or something that people should do if they have scoliosis. But I'm going to talk about these three different sports and the prevalence of scoliosis. It's important to understand that as I'm going through this, I'm not saying that these activities cause scoliosis, but what we are talking about is an increase in prevalence or an increase in the number of people in these groups that we find that have scoliosis. So first thing I'm going to talk about is swimming and spine deformities. And this was an interesting paper because what they did is they looked at 112 adolescents. So adolescents would be teenagers, typically between the ages of around 12, 13, and 18 years old. And they looked at those that were involved in competitive swimming compared to those that were not involved in competitive swimming. So they had 112 adolescents that were competitive swimmers, and they compared that to 217 students that were not competitive swimmers. And the average age was about 12 and a half years. And they also looked at those that swam that had back pain compared to those that didn't swim, that what was their prevalence of back pain. And how they measured scoliosis is using something called the scoliometer. And what this is it's a device that measures how much your spine is rotated. We do the typical test where you put your hands together and you bend over, that a lot of us did when we were being checked or screened for scoliosis. And they're looking for rotation in the spine. So let me go to here. So when they looked at this, they did find that there was an increased risk of trunk asymmetries like scoliosis, and also an increased risk of hyperkyphosis in those that swim compared to those that did not swim. They also found that females that swim had over a 2.1 times increase rate of low back pain. So the conclusion was that swimming was associated with increased risk of trunk asymmetries like scoliosis and hyperkyphosis. And although it has been considered a treatment option, this paper suggests that using this as a treatment approach for people that have scoliosis is probably not the best idea. Now, the next one I'm going to talk about, and part of that may be, if you think about scoliosis, especially in the thoracic spine, we know scoliosis is a rotation of the spine. And when you're swimming, you're constantly doing a rotational pattern where your hips are rotating one way and your upper body is rotating the opposite. So whenever you're doing something with repetitive rotation, that may not be best for a condition that is a rotary problem. But what about ballet dancers? And we also look at people that are involved in rhythmic gymnastics. And in this paper, what they did is they looked at ballet dancers compared to non-ballet dancers. And they found that in the average population, there was about 3% of non-dancers had scoliosis, but it was about 30% of the population. You can't see that it's cut off right here. It was about 30% of the population were dancers that had scoliosis. So there was a 12.4 times increase in likelihood of teenagers to develop scoliosis if they were involved in competitive dance compared to those that were not involved. Now, why is this? We don't know 100%. It could be one, dancers, also gymnasts tend to be thin, more thin. People that are thin, maybe less stable. They are generally really flexible, so it could be related to hypermobility. A lot of times dancers and gymnasts have delayed onset menarche, which, if you understand how scoliosis develops, which scoliosis tends to progress during the first year to two of puberty, delaying that could possibly increase the risk of scoliosis. But they concluded that adult dancers had a significant higher risk of developing scoliosis compared to non-dancers. So this is something to be aware of. And we look at, do we recommend not doing this? Well, if we know statistically those groups have a higher rate of scoliosis, if someone has scoliosis, they are likely or probably not the best activities to do. However, in my opinion, if I have someone that their passion is to do dancing or scoliosis or swimming, if they're compliant with the treatment, I'm willing, then I think those are okay to do. Because I'd rather have someone that's compliant with the treatment and they still get to be rewarded by doing something they're passionate about and that they really enjoy versus giving those things up. But those are questions I get asked a lot, is like, is there any like sporting activities I should really be aware of or not do if I have scoliosis? So potentially not. So competitive swimming, competitive dance, competitive gymnastics. And when we say I say competitive, I'm not talking like you go swimming once a week and you play in the pool, or you go do some gymnastics. We're talking about people that are spending several hours a week doing this intensively and competitively. So I hope that's helpful. If you do have any questions or comments, put those comments below and I will do my best to reach out and answer those. And then again, if you know someone is dealing with scoliosis and you think they may be able to use our help, be sure to share this video and direct them to our office. All right, that is all for our weekly live at 5. So I hope that someone there finds this helpful.